Today in the United States, a huge wealth gap and a huge health gap divide black and white communities. Let's zoom in on one representative city, Boston. The median net worth of white households in 2015 was almost $250,000. For non-immigrant black families, $8. In parts of the wealthy, mostly white neighborhood of Back Bay, life expectancy approaches 90 years. In parts of Roxbury, a mostly black neighborhood just a few miles away, life expectancy is closer to 60 years. This isn't just a Boston problem. Throughout the nation's history, black people have lived shorter lives and had worse health than white Americans. How did we get here? It's due to structural racism. For centuries, racism has been embedded in our economy and society, produced and reproduced by laws and practices sanctioned and implemented by government. The legacy of the slave trade, when Africans were sold, beaten, raped, torn from their families, exploited and uncompensated for hundreds of years, followed by a long reign of terror, and coupled with our long history of segregation and disinvestment, has directly harmed health and inequitably shaped opportunities. Discriminatory policies have prevented black people from buying homes in well-resourced neighborhoods, from taking out loans to start their own businesses, from having access to good schools and colleges, from advancing in the workplace. Structural racism contributes to the lack of green space and the pollution that far too often chokes black neighborhoods, to police brutality and repression, to our unjust legal system, to the limited access to nutritious foods and quality healthcare in black communities. How can we begin to redress these long-standing harms? One potential path is reparations, designed to compensate people and communities damaged by injustice. In the U.S., policymakers at the local, state, and federal levels are considering reparations for descendants of those enslaved and other black people. Reparations could take the form of direct cash payments to individuals paired with investments in black communities. The focus is often on closing the racial wealth gap, but reparations could significantly narrow the racial health gap. Reparations could give black families access to resources that are critical to well-being, but that have long been denied to black people. Resources like better neighborhoods, better schools, more green space, and clean air. And by allowing black families to pass on wealth to their children, reparations, along with race-conscious policies that actively work to dismantle structural racism, could break the cycle of intergenerational poverty and poor health. This is the moment for the health community and those already working on health equity to join the conversation around reparations. We must be at the table to close the health gap and correct centuries of injustice.